Congratulations on your new kitten. I'm Dr. Sarah Wooten, and in this video, I'm going to give you 5 kitten care tips that will change your life. Number 1, prepare ahead of time. Even before you bring this kitten home, you are going to want to prepare your home and make sure you have all of your supplies. So first, gather your supplies. That looks like your litter box, a cat carrier, food and water bowls, toys, ID tags, treats, food, all of that stuff. You're going to want to have all of that in place before you bring that kitten home. If you have a very small kitten, you may need to get a litter box with lower sides to start. And you also need to make sure, if you have other cats in the household, that you have an area where you can keep this kitten separate from other cats until we are sure that this cat does not have any infectious diseases. And also keep it in a small controlled area so it can learn to use its litter box. We can slowly introduce cats if you already have cats in your household. And the other thing that people often forget is that your house looks like a huge, expansive space to a kitten. They don't know where it starts or where it ends. So the recommendation is to usually start out with the kitten supervised at all times. And when they're not, you're going to want to have them kept in a smaller area, and then you slowly make that area bigger over time. That way they slowly get to know the whole house. When you are letting them out, you're going to want to make sure that they're supervised. You're also going to want to make sure that house is cat-proofed before you bring the kitten home. So cover or bar access to all electrical cords that they could chew on. Also, any strings or hair ties that they could chew on or swallow, put them away. Medications, recreational drugs, all of that stuff needs to go away, and the kitten needs to not have access to any of it because they're very curious and they will chew on things. If you have places that you don't want the cat to go, or you have furniture that you don't want them to scratch, you're going to want to bar access to this. And so what I think is really helpful is double-sided tape. I'll put the tape down on counters. I'll wrap legs with double-sided tape. Some cats don't like saran wrap, some cats don't like tinfoil, some cats don't like it if something is loud. Also, you can just close the door to the area that you don't want. But you're going to want to cat-proof the house and gather all of your resources before you bring that kitten home. You want to make sure to give your kitten lots of opportunities to scratch, both vertically and horizontally. And you want to give them a variety of substrates as well. So you're going to want to do some sisal rope, maybe a little carpet, maybe a little cardboard, lots of different things for them to scratch. But scratching is an important behavior. It's important to their mind. It's important to their body. Do not declaw your kitten. It is painful. When we do it, we cut off this part of the finger here. So I don't recommend it at all. Get down on all fours and put your head really low to the ground and look around, because you're gonna get a different perspective and you're gonna see the house the way your kitten does. You're gonna see different things. You're gonna be able to cat-proof even better. And so that is tip number 1. My second tip is for veterinary care. When it comes to veterinary care, it is just part of your kitten's life. And you're going to want to budget ahead of time. Otherwise, you're going to get sticker shock when you go in there because veterinary care is expensive. And so depending on the age of your kitten, if they're 6 to 16 weeks of age, I would plan on 3 to 4 kitten appointments during that time frame, and then an additional surgery appointment around 6 months of age. You will want to have them tested for leukemia and AIDS around 14 to 16 weeks of age. You are going to want to have their poop tested for parasites and have them dewormed. You are going to want to have kitten vaccines, the core ones, done for your kitten. So that would be FVRCP, which is a combo vaccine, and then that would also be rabies. FVRCP, the combo vaccine, is 3 boosters, at least 3 boosters, 2 to 4 weeks apart between 6 to 16 weeks of age. Rabies can be given anywhere 14 to 16 weeks of age and must be given by a licensed veterinarian for it to be legal. Other things as far as veterinary, yes to microchip. Microchipping has saved many, many lives. It's a way for your cat to be reunited with you if they are ever lost, because most veterinary clinics and shelters and rescues have the scanners, which contains your information. So I say yes to microchip. It is a bigger needle if you're worried about the pain. A lot of people have it done during the spay-neuter procedure. Speaking of which, spay-neuter. Yes, you want to have your cat, your kitten, spayed or neutered around 6 months of age, because that's when they go into sexual maturity and a 6-month-old kitten can get pregnant. True. So you're going to want to have them spayed or neutered. Female cats will continue to get pregnant over and over and over again. They can have up to 16 to 20 kittens a year. Male cats, if they are not neutered, they can develop problems with roaming, biting, spraying. They stink. They have really big heads, and they're more likely to want to get out. So spay or neuter your kitten. Also, dental care is really important. We don't think about it as much in cats, but cats do get a lot of dental disease. So if you have a kitten, it's a great time to get them trained to have their teeth brushed. You want to brush those teeth every 72 hours because it takes that long for plaque to turn into tartar. And then if we go back to the financial piece, I understand. Veterinary care is really expensive. So there are different ways to do this that will not break your budget quite as bad. Some of the bigger chain veterinary clinics, such as Banfield, have an amazing wellness plan that is very affordable and includes all of the wellness care you're going to need the first year. I think that's a great plan. You can also get insurance. A lot of insurance plans will have a wellness care rider that you can put on that will help you budget. As far as having the spay-neuter surgery done, I always do recommend having it done at your local veterinary clinic versus a low-cost spay-neuter facility if you can. The reason being is your local clinic will provide high-end, really good care. And that comes from the beginning to the end of the surgical experience. And that includes pain control and checking blood work before they go under anesthesia, and doing things like laser therapy. So many great things. I actually worked at a shelter and did high volume spay neuter. And while there's definitely a place for it, if you can avoid it, I would recommend avoiding it. And I would go to your regular veterinarian. And the reason being is there's typically not blood work run. They don't do as great with the pain meds. They often don't offer things like laser therapy. And because they see so many pets going through there, there's often a higher risk of infectious disease. I do see a lot of these kittens coming back with runny eyes and sneezing and all of that. So that's my recommendation. Also, take your kitten into the veterinary clinic for what I call fun visits. Veterinary clinics are really scary for kittens, but if you can take them in fairly regularly and just have the staff feed them treats or play with them or pet them, that builds a positive association in their mind so that when they do have to come in and have something not so fun done, like get poked with a needle, it's not such a big deal. So I do recommend fun visits as well. All right, my next tip is all around playtime. Playing with your cat, with your kitten is really important. We think about it a lot with dogs, but now we know that these cats need playtime as well. They need to be moving. They need to be engaging their minds. It prevents boredom. It prevents stress-related behavioral disorders and health problems. So there's lots of different things you can do to play with your cat. I recommend at least 4 15-minute play sessions per day because cats have really short attention spans. And if you can just do 4 really high active, fun play sessions a day, that is a wonderful way spread out throughout the day to give them some playtime. If they are biting at you, what I would recommend is to immediately redirect them to a toy and then give them some praise. Try to redirect that normal aggression that they have to toys as much as possible. If they're not getting it or they're still wanting to attack your hand, you just end the play session. You just walk away and you're done. If you use a laser pointer, if they chase a laser pointer, make sure to have the end of that play session where they can actually catch the laser pointer. And so what that looks like is putting the laser pointer, ending it on a piece of kibble or a treat or a toy or something, so that the kitten can pounce on that and feel some success in the hunt. Otherwise, they can develop behavioral disorders where they chase shadows. So you always want to have them be able to catch something when they're doing the laser. I recommend having the last play session be at least 1 hour before it's time to go to bed, so they have time to wind down. And then as far as like outdoor playtime, that is great too. And if you have a kitten, it's the perfect time to train them to walk on a leash. And a lot of cats will walk on a leash and be perfectly fine with it. One thing I don't like, those cat backpacks that have the clear plastic bubble. I mean, there are some cats that like that, but most cats that I see that are riding around in those things are freaked out. So I don't recommend them. If you have a cat that likes the cat bubble backpack, let me know in the comments, because I still haven't met one. Okay, so my next tip is surrounding feeding and weight control. One of the biggest problems we have in our indoor cat populations is they're just all too fat. And fat, obesity is an inflammatory condition, it's a hormonal condition, and it leads to so many other health problems, including arthritis, heart disease, cancer, kidney disease, so many problems. So you're starting out with a kitten, it's perfect time to start. Start now. I recommend multiple meals throughout the day, and depending on the age of your kitten, very young kittens need to eat every 3 to 4 hours. Older kittens, like your 12, 13, 14 weeks, they can do 2 to 3 meals per day. And I would recommend feeding a combination of canned and dry food. I would also recommend giving them a couple of different flavors and textures within the same brand of food to avoid the cat developing strong food preferences later in life. I also like doing both canned and dry because canned is high moisture and high protein, and it is a great way for them to get that needed extra protein and moisture. Your kitten's appetite will wax and wane as they're growing. Sometimes it will be really, really high because they're going through a growth spurt, and other times they're like, I don't really want to eat. So you're gonna have to tailor how much you're feeding them depending on how much they're eating. If your kitten is thin and gobbling down the food and looking at you, feed them a little bit more. If they're chill about their food and seem to be a good weight, cut it back a little bit. It's gonna be a little give and take during the first couple of years. You're gonna wanna switch to an adult formula around 6 months of age. 6 months of age is also when most of these kittens get spayed or neutered, and they'll reach their full size between 8 to 10 months of age for most breeds. So ask your vet for their ideal weight and how many calories they should be eating daily once they reach their full weight. Even better than measuring it in a cup, ask them how much you should be feeding in grams and weigh the food on a gram scale. That is a more accurate way to control their calories. And with these smaller cats, even just 1 to 2 extra kibbles per day will lead to weight issues. So stay ahead of it now, and you are going to help your cat a lot in the future as well. My last tip is all about socialization. Socialization is how your kitten builds their picture of what their world is about. And kittens that are properly socialized are very outgoing, confident, happy kittens. Kittens that are not properly socialized become very fearful and often very aggressive kittens or cats. Your critical socialization period for cats is between 6 to 14 weeks of age. This is when they decide what they're afraid of or what they're not afraid of. This is when and how they build their picture of the world. So between 6 and 14 weeks of age, you want to give that kitten a variety of experiences with different things, situations, locations, people, other animals, etc., etc., etc. So included in that, I would include socializing them to be able to have their nails trimmed. So if you start with a very young kitten and you do just 1 or 2, maybe you just do 1 paw a day or 1 nail a day, and you are consistent with it over a long period of time, and maybe you pair that nail trimming with 1 special type of treat that they don't get any other time, then when you have an adult cat, that cat's gonna be really easy to train their nails. The other thing that a lot of people don't think about is socializing their cat to their cat carrier. A lot of times, the first time a kitten or a cat goes in the carrier is when they go to the vet. So imagine if you're that cat or kitten. You get put in this box, put into a car, which is very scary, and then driven to the scariest place on the planet, which is the veterinary clinic. So one thing you can do to make this easier is to get your cat used to that cat carrier now. So leave the cat carrier out in the house. Put some toys in it, put some treats in it, put their bedding in it. Make it just something that they can hang out and relax and be happy in. That way, when you put them in there and take them somewhere, it's gonna be less of a problem. In addition, practice sometimes shutting the door. Leave it open most of the time, but if they go in there, shut the door for a couple of minutes and see how they do. This is all important ways to help your cat be more comfortable and confident as they grow. When it comes to socializing with other animals, make sure that your kitten is socializing with adult animals that have already been certified to be free of infectious disease and hopefully vaccinated. Don't do cats that you don't know their vaccine history or anything that looks sick. Socializing with dogs, great. Other animals, great. Lots of people, children, lots of people in wheelchairs, tall people, short people, people of different color. Also, give them lots of different locations. Your house, the veterinary hospital, maybe the pet store, maybe just riding around in the car. These are ways to help your cat have a more confident life. There's a great rule called the Rule of 7, which during the critical socialization period of 6 to 14 weeks, you give them 7 different experiences every day as much as possible. And this can even be different new experiences like a different texture, like a blanket texture or sand, or maybe they're walking on grass, or maybe it's a different sound they've never heard or anything like that. So look up the Rule of 7. It's a wonderful way to socialize your kitten. And that is my last tip. So there you have it. Prepare ahead of time. Make sure you are good and ready for veterinary visits, kitten visits. Do a lot of playtime, control their food, and then make sure they're properly socialized. If you follow all that, you're gonna be able to help your cat be happy and healthy as possible. So thank you so much for watching. I hope these tips are helpful, and let me know in the comments if they are.